3 guesses what this thing is. Well, it's the sort of freebie you get at an obesity conference. It's a gastric band pen, of course. You also get gastric band wristbands, which say, "I'm with the band." But would you consider obesity surgery? Last year, hundreds of these operations were performed in the US and in the UK. It's quite literally a growth industry.
Here in San Francisco, all the experts are gathering together to discuss, amongst other things, what is obesity, how to tackle it, and whether surgery is the answer.
And it's this little ring that's causing most of the fuss, the adjustable gastric band. It can be placed around a patient's stomach laparoscopically and is generally safer than its predecessor, the gastric bypass, where the stomach is cut and rerouted. Opinions are very divided on which is best. But is surgery itself the right treatment for obesity? Isn't it tackling the symptoms, not the cause? I asked the man who's credited with developing the modern gastric band.
Well, if somebody has terminal cancer, do you, from smoking for instance, do you chastise them for having smoked for 40 years, or do you treat their lung cancer? Do you try to help them? If somebody has severe chronic colitis that might be ameliorated by almost eating nothing and just having some bland diet for the rest of their life, do you make them suffer that, or do you try and treat their disease and help them? Obesity is a disease. It's an absolute reality. So to just say you're not treating the disease and let them essentially die from the disease, at a minimum, is cruel. It's a very arcane and backwards way of thinking to my thinking.
Are you surprised that there are surgeons here now already performing the operation on youngsters?
No, not at all. There are limitations in the United States because of labeling and concerns about liability. The surgeons who look at the options, I've considered it myself. My 14-year-old doesn't need obesity surgery, but if she did, there's no way my wife or I, over our dead body, would she have a gastric bypass. How can you do a procedure that is so complete, total, and final, and so altering on a young person like that? The critics against using the band will say, well, we don't know what that foreign body, that silicone thing, is going to do in 20 or 30 years. Well, actually, we know more about that. We know more that it's stable, it's an inert, secure device, and actually inside the body is a wonderful place to keep it. Out of the sun, out of air, it doesn't age at all inside the body. And there are data now, patients have had the band for 13 years. The previous device, patients have had the band for 25 years.
Do you think someday somebody will come up with something better?
Oh, certainly. I'm working on something better. Actually, my company and a wonderful group of brilliant engineers are working on the next generation. There's always a way to improve, and there are ways to improve the lap band. Paul O'Brien from Australia talks about the day that somebody comes up with the combination drug therapy and a laser that activates it in your ear. Bang, you no longer have the trigger for being obese. And well, all these lap bands you can just take out then, can't you? What can you do for all those gastric bypasses? Surgeons describe them as reversible. How? When most of your stomach is no longer attached or is gone in some procedures. How is that a reversible procedure? I don't understand that.
While surgeons argue about which procedure is best, prospective patients are asking for banding because it's lower risk. In the US, though, some insurance companies will only pay for the bypass even if patients want the band. One patient to whom that happened was Carney Wilson, who was at the conference too, endorsing a life insurance company. She had a gastric bypass 7 years ago and lost 9 stones. She's the daughter of Brian Wilson of the Beach Boys and had her own group in the 80s, Wilson Phillips. After having her baby 18 months ago, she's put a few pounds back on. And guess what? She's going on to American Celebrity Fit Club. I hope Harvey is nicer to her than he was to me.